I'm Dr. Kevin Gill, and I'm an orthopedic spine surgeon at Texas Back Institute. I've been an orthopedic spine surgeon for about 40 years. I've had the pleasure of both 20 years of private practice near the medical school in Dallas, and then 20 years at the medical school. And so I've had the opportunity to see both sides. Joining Texas Back is actually a coalition of both. Texas Back is Privatemics. It's the opportunity to continue my research that I've done for the last 40 years in an environment that offers excellent clinical care. Medicine as a career is a venture in many ways. It's a journey. My father and mother were incredible homemakers and incredible parents, and they taught me to just be a student. And sure enough, my gift was science and math, and that led me automatically into those fields of technology, science, mathematics. My path was definitely in the path of science, ultimately biology. And then medical school, what I did with medical school was I went to Baylor College of Medicine in Houston because it was a 3-year school. And my interest was to get ahead and to be a spine doctor ultimately. And so medical school is really about the biology of wellness, the biology of humans, which is my other interest besides spine, is the idea of wellness care. My background is really in the area of degenerative disease. I was trained by world-class people who taught me about degenerative disc disease when it wasn't a popular topic. And therefore, all of my concentration, my studies, my academics, all of my academic research is on what causes degenerative disc disease, which defines back pain. What are the ultimate causes of back pain? And that's been my interest through not only my research career, but also my clinical career, which involves both evaluations of patients that need a discectomy or a decompression, patients that need a disc replacement, or patients that actually require a lumbar or cervical fusion. Orthopedic surgery is a field that really appeals to the mechanic, and I was raised by a mechanic father who was an electrical engineer type, and a grandfather who was always a mechanic, dirt contractor type. And so these two men established with me using my hands, doing things with my hands, being involved with people, but doing it something for them. And it was just that type of exposure, I think, that led me to orthopedics. Back pain in some patients is a one-time event. In fact, in most patients, back pain treatment is a one-time event. For example, if I have a disc herniation from lifting a heavy rock on the weekend working at my home, then a microdiscectomy or an endoscopic surgery can treat that. And in fact, most orthopedic spine cases are that way. But the field that I went into is more degenerative disc disease, back pain, or neck pain. And it continues for life for many reasons we don't understand. Much of my research work has looked at that question of what causes back pain and why do we continue to hurt even though it's not serious pain, it's pain, and patients want to know why they hurt and they want management of their pain long term, and therefore they stick with you. Outside of medicine, I find myself really thinking about health, wellness. The pandemic sort of made me rethink lifestyle. When the pandemic hit me and I was at a point in my life where I thought, well, maybe I should take better care of myself, sleep better, handle stress better, exercise more. Really what I did is I work on things that are actually health-related things. I use a lot of technology that really monitors your health, and I've really had an interest in that. Besides that, I've always been a reader. I told you I liked academics, and so academics really makes a reader. So spine and wellness come together in many ways, and wellness is an opportunity to deal with human characteristics that make us better, that make us healthy. And what does that involve? It certainly involves the quality of your activity level. It involves your food intake. It involves your sleep quality. And it involves also, most importantly, how you handle stress. All of those come together and create a human being in wellness. So whether it's physical, mental, some type of social interaction, you must be healthy. You also have to be well. To be well, you must manage all of that at the same time. What I enjoy about Texas Back Institute is the fact that you can combine your abilities with an opportunity to serve. And I mean that in two different ways. One way to serve is through research, clinical research on patients involving in clinical studies. The other is teaching. There's fellowship, fellows that are involved in a fellowship training, and we're able to really share with them not only our expertise, but also through conferences, teaching them how to think, how to reason, and how to decide what patient is best for surgery and which patient is best to not have surgery. Those kind of things are really critical. My legacy coming to Texas Back Institute as a faculty member and as a part of this community is to share both research, teaching, and clinical expertise in a way that it serves not only the community of Dallas-Fort Worth and the suburbs, but also serves all Texans in a way that it makes a difference in their spine care.